Welcome to Beauty Times Medicine, our video and broadcast series, which explores the latest innovations in dermatology and aesthetics and their applications for patients and consumers. Joining us today is Dr. Michael Somenek, a double board-certified facial plastic surgeon based in Washington, D.C. Dr. Somenek is known for his expertise in clinical research and facial aesthetics, from surgical procedures to non-surgical treatments, and above all, for helping patients achieve natural, beautiful results. What an excitement to have you on Beauty Times Medicine. Welcome.
Thank you for having me.
Very impressive background. I think that's the least you can say. And on top of that, I read recently that you have been named Best Plastic Surgery and Aesthetics Practice by DC Magazine for 4 years running. And I think you're also in the process of setting up practice in New York City. Wow. But if we go back to the beginning, what brought you into plastic surgery and then into aesthetic treatments?
You know, I don't think my journey into plastic surgery has always been so straightforward. I started with head and neck surgery. In the United States, it's a 5-year training program. And so we don't really get exposure to all the subspecialties right at the beginning. So once I got exposed to the field of plastic surgery, and I've always had a love for skin, a lot of the things that are in plastic surgery, like symmetry, creativity, it really resonated with me. And so I think that drove my passion ultimately to go into facial plastic surgery.
And if I'm a patient, what would drive me to a treatment by a plastic surgeon? What would be the thought process? Why would I seek out a plastic surgeon?
I think we think of things a little differently regarding anatomy. And, you know, the head and neck surgery training that I did, it's 5 years of intensive training of head and neck anatomy. And so I look at things very three-dimensionally, and I've always thought of things like that. And I think that's really how we as aesthetic providers need to think of treating our patients as well. And so it really aligns with how we can optimize results.
In your practice, you also have to balance a little bit between surgery and aesthetic treatments that are non-surgical, because I'm sure there's a time perspective, there's many other practical things you have to consider, but how do you balance that?
If you interview other surgeons, they want to operate, right? But when I first started my practice, it really was built on the foundation of non-surgical treatments because I didn't have a line of surgery waiting outside the door. And so because of that, I still have a passion and a love for it. And as you know, I do a lot of clinical research on a lot of non-surgical treatments. And so I dive into the science and really the background on a lot of these things. And so I've always maintained that foundation within my practice, independent of my surgical practice increasing. And my patients love that because I'm able to provide a really well-balanced treatment for them.
But does the discussion start off being kind of first about plastic surgery and then maybe later about other treatments, or is it kind of a combined discussion at the beginning? How does that work?
I think it can come in various forms depending on patient expectations and ultimately the outcome they're looking for. And some patients aren't looking for a surgical result. And I'm able to offer a lot of patients where I'm not turning them down because I can't say I don't do this or I don't do that for them. And in fact, I really think they appreciate the fact that I'm able to offer such a large menu of services to them.
And how does a discussion, for instance, about fillers, is that something you bring up during the discussion when you discuss potential surgical options, or how does the filler discussion come, so to speak?
It inevitably always becomes incorporated into the conversation because volume loss, we are all experiencing it. And so you really need to bring that up, address it in order to optimize your outcomes, regardless of what kind of surgery that you're performing. Sometimes as surgeons, you can do the best surgery intraoperatively, but if you fail to address some of the volume deficiencies within the face, it can really create a suboptimal result for them.
So patients say, I want a natural result, or you saying if you combine, you would get a natural result? How does that discussion come, so to speak?
I think it's all about proportions.
Okay.
And you really have to discuss facial balance, facial proportions. And a lot of the times, particularly when we see someone that may look disproportionate, it's not because the injectable has been a bad treatment. It's their injectable journey has gone awry. And so I always talk about facial balance, and I have them hold a mirror. Sounds kind of cheesy in a way, but I have them hold a mirror and I go over their whole face because it's important to really look at it from a much more global perspective in order to understand, oh, this is a little off or that's a little off. And it resonates with them when you do that.
And you mentioned earlier that clinical research is very important for you, and medication-driven weight loss is, I think, really a big theme in healthcare these days. And instead of talking about it, I understand you've been involved in a clinical trial and already have some results. How did you get into that field, so to speak?
Well, I think particularly being a US aesthetic provider, we have seen an exponential growth with patients that are on medication-driven weight loss. And because of that, we've seen many changes. And so as I saw this evolve with many of my patients and saw some of their concerns, there was clearly an unmet need where we needed to develop something to figure out if we can address their volume deficiencies and other things that they were complaining about. And so that really led to the research that we have now jumped into, and we're almost concluding.
So I understand there's an additional 6 months follow-on to the initial results. What are you expecting from that? Why the prolongation of the trial, so to speak?
The basis or the foundation of the trial was to address some of the needs of the patients, which was mainly volume loss and skin quality changes. And so we took a series of treatments for them where we used a combination of dermal fillers, hyaluronic acid fillers within the Restylane portfolio, as well as Sculptra to the lower third of the face. And we treated them in a series of treatments over the course of several months and followed them because we really wanted to see, number one, are we able to address these volume deficiencies, but also what is going on in the lower third of their face? Are we able to stimulate collagen and elastin and improve the overall skin quality? And so early on in our 3-month interim results, we see super high subject satisfaction, which is really, that means the world to me, because that's ultimately what matters most is, are the subjects satisfied, independent of what I think as the investigator? The reason why we did the extension is because Sculptra doesn't work overnight. We know that from the science and the mechanism of action that is very well published. And so with this extension, we hope to see at least a sustained response within the subjects.
So is it clear from the initial results that you will need to use both a filler and Sculptra, or what are you seeing?
This is where the holistic individualized treatment comes into play, because everyone's journey with medication-driven weight loss is going to be very different. That is dependent on your age, your height, your environmental factors, your overall nutrition status. I think there's so many things that contribute to what impacts we see on a patient that is on medication-driven weight loss. And so
And how's this man to come out with, I would say, like a scheme that physicians can use to treat these patients, or what's the ultimate purpose, so to speak?
yeah, I think a protocol exists for a reason, to provide general guidelines. And I think the combination of using dermal fillers and collagen stimulators is ultimately where we need to go with most of those patients. The quantity of those things is going to vary, though, based on how their journey decides to evolve.
My colleagues have done some research. I think about 11% of patients that are already on or have medication-driven weight loss are on some kind of treatment, whether it's Sculptra, whether it's a filler. And I think even 12 or more percent are thinking about. So how do you see this going forward? These are pretty high numbers, isn't it, already?
Yeah, well, when you talk to these patients, the main thing that they will complain about is they feel like they look older. So they're clearly noticing the changes that we are noticing as aesthetic providers. And so I see the need for them seeking aesthetic treatments only going up, especially when we see the use of this, not going up just in the United States, but internationally as well.
Have your research so far given any insights or your interaction with patients? Is there a particularly good time to start this treatment? Is it something you should do right as you go on a GLP-1, or is it something you do later? Is there any insights about what's the best time for a patient to consider such a treatment?
We have to see how patients evolve. And it's important to stay closely aligned with your aesthetic provider throughout this journey, because as the changes start showing the impact on your face, we can address them along the way. And in some cases, we can be proactive on it. In other cases, we don't necessarily need to do that because, again, your age really plays a role in that and what your underlying collagen and elastin density is at baseline.
I was recently in the Middle East, and there the numbers are even higher of patients that show up in aesthetics or plastic surgeon practices and have medication-driven weight loss and some of the facial appearances that you can get with that. But is this a discussion you proactively now start, or do the patients basically themselves say, oh, by the way, I'm on a GLP-1? How does that discussion come up, so to speak?
Sometimes it comes up very organically. A lot of the time, though, it comes up 2-3 months after they've started their medication-driven weight loss journey. They've lost a few pounds, and I take notice as the aesthetic provider saying, oh, have you lost a little weight? So it doesn't always come up where they say, I'm starting this. And what is my treatment algorithm? Because they don't really even know the changes. And that's the one concern that many of them have is they don't want to start an injectable journey right off the bat because they're not sure what the changes are.
Okay.
And they don't want their face to feel fat. It's a huge, that term with them, but they don't want a fat face. And we hear that all the time.
And you mentioned that some of the initial results showed satisfaction or people feel better. Is that because they look in the mirror and they feel, oh, I look better again? Or how do you see that?
I think what was so important on what we're able to show right now in the study is that we're able to achieve natural results and the subjects agree with us. We're aligned on that. They feel more youthful because remember, they were feeling older when they presented to us. And so by creating that balance, creating that proportion that we talked about, we're able to show them, oh, yes, your face still does look slim, but you look healthier. Your skin quality looks better. And so those two things, I think, really helped our subject satisfaction scores.
Well, Dr. Somenek, thank you so much for joining us. It's been absolutely a pleasure, and we learned a lot, and we look forward to more insights.
Thank you for having me. More to come on that.
Well, thank you for joining us on Beauty Times Medicine. We're excited to continue bringing you more expert insights and leading voices from the world of dermatology and aesthetics. Be sure, absolutely be sure, to follow us on social channels and now on Spotify for more episodes and updates. Stay tuned.